Good afternoon, everybody. Before we begin, I'd like to acknowledge the folks who are here today. I'll start with Mayor Alsberry, Commissioner Aguilar, Commissioner Gordon, Commissioner Stamp, Mayor Clark, help me, Ann Evans, and Angela Smith from the village of Maywood, representing Mayor Booker. Did I get that right?
Yes.
I apologize. All right. I want to thank our county staff, particularly our Bureau of Economic Development, without whom we wouldn't be standing here today. That team includes our Bureau Chief, Sochi Flores, Deputy Bureau Chief Dominic Tossi, Curtis Whittick, the project manager for this initiative. Thank you to all of you. I'd like to recognize the CEO of Elevate, Ann Evans, and the entire Elevate team who've been instrumental partners in this effort. Now, it's no secret that America has aging infrastructure. From our roads and bridges to pipes that lead to our homes, significant and meaningful investments throughout the entire country are needed to close the glaring infrastructure investment gap. In the latest American Society of Civil Engineers Infrastructure Report Card, the group gave the United States a C, highlighting our nation's decaying infrastructure in a variety of areas. Now, I know as a former history teacher that if you don't immediately address some challenges, a C can turn quickly into a failing grade tomorrow. So while Cook County is not immune to the aging infrastructure challenge, we won't stand idly by. Many of you have already heard about some of our signature Affordable Rescue Plan Act initiatives, such as our Guaranteed Income Pilot or our Medical Debt Program. We have more than 70 initiatives in the works due to President Biden's transformative American Rescue Plan Act legislation. Today, we're proud to announce our latest ARPA initiative, LeadCare Cook County. Through our LeadCare Cook County pilot program, in partnership with Elevate, along with my office's ongoing Project Rainbow initiative, we're offering free lead service line replacement to licensed home-based child care providers in suburban Cook County. Now, we had a productive meeting with our partners at, I'm reading the next event. I apologize. Oh, Lord. Okay, let's try again here. Not quite ready for prime time today. This is our pilot year, and during this time, we will include child care providers based in 5 areas to start: Calumet City, Cicero, Harvey, Hazel, Crest, and Maywood. We have plans to expand our pilot in future years, eventually reaching all interested communities in suburban Cook County by 2025. Through our $15 million LeadCare program, we will help our municipalities address chronic aging infrastructure, disinvestment, and inequities that have plagued too many communities for far too long. For any licensed home-based child care program residing in our pilot area locations, and you're interested in enrollment, you can go to www.leadcarecookcounty.org to learn more. That's www.leadcarecookcounty.org to learn more. I believe in clean, lead-free drinking water. That's a human right, just like housing or health care. And Cook County is going to do its part to help ensure that we help close America's infrastructure investment gap, so our youngest Cook County residents have a fair and equitable start to their promising lives. Now, I would ask each of the people who's going to come forward to introduce the person who follows them. Commissioner Gordon, I believe you're next. Commissioner Aguilar and Commissioner Stamps, we're grateful for the fact that you joined us. I believe after Monica will be Ann Evans of Elevate.
Good afternoon, everyone.
Good afternoon.
Today we gather here to celebrate a remarkable milestone in ensuring the health and safety of our youngest residents. The launch of Cook County LeadCare marks a significant step forward in our commitment to providing children with a safe and healthy environment. I thank President Preckwinkle, Mayor Christopher Clark, Mayor Vernard Alsberry, CEO Ann Evans, Commissioner Aguilar, Commissioner Tara Stamps. I'm so sorry, Commissioner Stamps. Commissioner Stamps is a new commissioner that I'm excited to have here, that's all. And all the community members who have joined us today. Child care providers play a pivotal role in the lives of our children. They nurture, educate, and guide our little ones, shaping their futures and fostering their growth. We must ensure these providers have the resources and support to create a safe and conducive environment for our children to learn and thrive. One critical aspect of ensuring a safe environment is the availability of lead-free water. We all know the potential risk associated with lead exposure, especially for young children with vulnerable developing bodies. By offering free lead service line replacement to licensed suburban home-based child care providers through the partnership of Elevate and Cook County's Project Rainbow, we are proactively addressing this issue head-on. This program is a testament to our commitment to the well-being of our children. It sends a powerful message that their health and safety are a top priority. Through LeadCare Cook County, we're addressing the immediate concerns of lead in water and taking a crucial step toward creating a healthier future for generations to come. While today's launch focuses on child care providers, it is essential to acknowledge that this is just one piece of a giant puzzle. Our commitment to providing safe, lead-free water extends to every resident of Cook County. We understand the urgency and importance of this issue, and we're dedicated to ensuring all of our communities have access to clean, healthy drinking water. The launch of Cook County LeadCare is a significant milestone, but it is not the end of our efforts. It is a stepping stone toward a comprehensive approach to lead mitigation in our county. We will continue to work tirelessly, exploring innovative solutions, implementing best practices, and collaborating with community stakeholders to address this issue holistically. I want to assure you that we are committed to ensuring every resident has access to lead-free water. We will leave no stone unturned until we achieve this goal. We will create a healthier, safer environment for our children, families, and communities. In closing, I sincerely thank everyone involved in making Cook County LeadCare a reality. Your dedication, passion, and tireless efforts have brought us to this moment. Let us celebrate today as a symbol of progress and a reminder of the work ahead. Thank you again to President Preckwinkle, Mayor Clark, Mayor Alsberry, CEO Ann Evans, and all the elected officials and community members for joining us in this meaningful celebration. Together, we will build a future where all our children can access safe, lead-free water, ensuring their health, well-being, and bright futures. Thank you. Next, I would like CEO Ann Evans to join. Thank you.
Thank you all. I'm very excited to be here today. I'm Ann Evans, CEO of Elevate. Elevate is a Cook County-based nonprofit organization working to create healthy environments for children to thrive. We've been doing this work across Cook County for over 2 decades. We are so grateful for the leadership of Cook County government, and we're thrilled to partner with the very amazing team at the Cook County Bureau of Economic Development to implement the LeadCare Cook County program to remove lead service lines from home-based child care providers, beginning, as you know, in Calumet City, Cicero, Harvey, Hazel, Crest, and Maywood, and expanding across suburban Cook County communities in the coming years. LeadCare Cook County addresses historic disinvestment and inequities that have impacted the health and well-being of residents and our children. Lead is a neurotoxin. There is no safe level of lead exposure. When present, a lead service line can be the largest contributor of lead in drinking water. Lead exposure has health implications for people of all ages, but especially damaging to infants and children under the age of 6. Child care providers are providing essential services in our communities. They are creating safe and healthy space for children to grow and learn. Like the vast majority of us here in Cook County, our homes are connected to older water infrastructure. That's why LeadCare Cook County is so important to provide this vital service to the child care community. Thank you for being here today. Thank you for the opportunity. And I'd love to introduce you to Mayor Clark.
Thank you. It's a pleasure to be here. I'm Christopher Clark. I'm the mayor of the city of Harvey. First, I'd like to thank, of course, this wonderful team that is here, our president, Preckwinkle, of course, our commissioners from Cook County, of course, the team from Elevate, and all of our Southland mayors as well. As a representative of a community that is going to be a beneficiary of this pilot program, I can only express how ecstatic I am to see it come to the Southland, and to the Southland first. Isn't that right, Alsberry? Youth and lead is an important issue, and of course, as you've heard several times before, the impacts that it has on our young minds. But I kind of take it from a selfish standpoint, because I'm a leader who won't be in this position much longer. I'm getting older, longer in the tooth, and at some point in time I won't do it anymore. But one thing I know for sure is that if we're taking care of the minds that are coming behind us, we will have people who have the bright minds to be able to take over in leadership and lead us into the future of where we need to be. Well, we know one thing for sure, as studies have shown, that children 6 and under can definitely be impacted by the effects of lead. And as previously was mentioned, there is no acceptable amount. So we have to do everything that we possibly can to make sure that we are combating this issue. I'm proud as a recipient from the city of Harvey, but I'm also proud of the fact that once again, under the leadership of our president, under the team of people who are here, that instead of waiting for something to happen, you're stepping in front of it. And that is the most remarkable thing that I can think of. This is my second term as a mayor in the city of Harvey, and the most amazing thing that I've been able to get from my experience is the fact that when people are really coming together in a concerted effort on an important issue, that things can get done. And so I would like to once again, let you know that this is how you can tell when an initiative is going to be successful. Just look at the people around you. And every last person that is here, we are definitely grateful for and thankful for. So once again, I'd like to thank everyone, of course, in attendance, of course, everyone who is representing here today, and that'll end my comments. And at that point, I'll turn you on to my colleague, friend, and the mayor, village president of the city of Hazel, Crest, Vernard Alsberry.
Well, you see, it's an exciting day, right?
Here, here.
I should have my glasses on, but I can read this, I think. In October 2020, the Village of Hazel Crest and the Board of Trustees passed a resolution for the location of eventually replacement of all service lines in the Village of Hazel Crest. Our early commitment to the removal of lead service lines has helped our community get a head start on getting the lead out of our lives and out of our family lives. I want to thank Cook County Commissioner Tony Preckwinkle and the LeadCare Cook County program. The program will help us accelerate our goal of becoming a lead-free community by helping over 26 home-based child care facilities to identify removal of lead service lines. It is estimated that almost 650 lead service lines are in our village. And while our water system provides safe and reliable drinking water, no amount of lead is safe, especially for our young and developing children. So again, I would like to thank President Tony Preckwinkle, Cook County Board President, our Monica Gordon, our commissioner, and the commissioners with us for leading us and assisting us with the LeadCare Cook County team for this viable public service. Again, thank you, Elevate, for elevating us to another level. Have a great day.
Thank you, Mayor.
Nice, nice.
All right. Nick?
Yes, Madam President, could you speak to how you chose these communities and how many child care facilities could be helped by this by the time the money runs out?
Okay, I'm going to ask, you want Dom? Okay. Dominic Tassi.
Good afternoon.
Good afternoon.
Dominic Tassi, Deputy Bureau Chief within the Bureau of Economic Development. And great question. Gonna make sure I get all the parts of it. So we did some kind of data analysis about which suburban communities to be part of our set of pilot communities, and looked at things like the number of child cares, home-based child cares within the community, mainly to make sure we had a good volume for our pilot period, but also looked at what we knew about lead service line prevalence in those communities. So looked for, things like whether or not, as Mayor Alsberry alluded to, some communities have a pretty good understanding of where their lead service lines are. Other communities are kind of getting started on that journey. So wanted to kind of have a mix within our pilot of communities that are at different points along that process of starting to replace their lead service lines. So those are the two big factors, and what we look forward to learning over this first year and then expanding.
And then in terms of how much can be given
Oh.
for each childcare facility and how many facilities you hope to be able to help further on that?
Sure. So the cost is, and I might invite, unless Ann, if you want to jump on the cost question when I'm done, otherwise maybe some of our additional partners can join in. But the average cost of a lead service line is around the kind of $10,000 mark, in that vicinity. Could be more depending on kind of exactly what needs to be done to do that replacement. So there are about 700 home-based child cares in suburban Cook County, kind of in that vicinity, and we think we can do at least 550 of those, so make a significant dent. If not, get that higher, and hopefully, one of our goals at the beginning was to try to be able to serve all interested licensed home-based daycares through this effort.
You did a great job.
Got the cost right. All right, good.
And then in terms of timeline, can this be done in like less than a week? Is the actual replacement itself?
Great. So here's where I'll definitely lean on my Elevate colleagues to correct me. But yeah, the work itself is in a matter of weeks. I think it is about a week if everything goes well. Does that sound right?
Yeah, I can just add on both things. The cost should be averaging around $10,000. It's going to depend on the distance from the home-based child care provider to the main. So it could be less, it could be more. And what was the second question? Time frame, thank you. The time frame should be within a week, assuming that we can pull and process permits quickly. Sure.
All right. Thank you. Always.
Have you been briefed yet on the cost of the changes to the state program for immigrant healthcare?
Well, here's my answer. There was a meeting last Friday with our partners at the state. And this is in regarding to healthcare for asylum seekers. So we share the goal of providing the care and services that our asylum seekers need. We don't have any news to share at this time. We're continuing to collaborate with our state partners to figure out the most effective and efficient response to their needs.
And so the asylum seekers is one thing, but then the state changes to the immigrant healthcare program. Have you heard anything new about that?
No, that was also part of the discussion, but I'm unclear about the outcome.
Anything else?
No, sir.
Are there any reporters, any other reporters here that I missed that would like to ask a question? Anyone? Thank you, everybody. All right.
Thank you, thank you.